Hi, my name is Jessica Schwinn, and my final presentation will be on supply chain management and how it relates to the healthcare industry. I want to provide you guys some quick background information on supply chain management. So supply chain is referred to as an integrated system. It focuses on strategy and can sometimes be called strategic coordination. Supply chain management can be defined as the integration of key business processes from end users through original suppliers that provide products, services, and information and add value for customers and other stakeholders. It can also be referred to as the route that items travel from the manufacturer to the point of use and payment. So why focus on supply chain management, especially in healthcare? In 2009, 17% of the nation's GDP was healthcare costs. This number is only expected to increase. Supply chain related expenses account for an average 31% of a healthcare provider's annual operating expense. So effective supply chain management is a great way to cut these costs down. That being said, effective supply chain management reduces costs, improves quality, increases productivity, reduces the cycle time, improves organizational performance, and can even impact patient health. So healthcare supply chain is different than other industries. There's a little bit more to it that just makes it difficult, and that's why it isn't fully implemented across the board. It is complex, diverse, and dynamic. There is increased complexity from the numerous companies and organizations involved, each with multiple points of interaction. There is variability resulting from providing each physician and pharmacy with their specific product preferences, especially when there is so many different types of one product that is manufactured by many different companies, therefore offering a lot of options. And also there are several distinct different supply chains in a healthcare organization. This is different from retail in that you're not just concerned with clothing, or from a store such as Walmart where you're not just concerned with the goods. This focuses on services as well. So you have to deal with the supply chains of pharmaceuticals, medical surgical supplies, medical devices, health aids such as bandages and syringes, office supplies, and clothing supplies. There are multiple participants in the supply chain cycle as well. This includes the manufacturers of drugs, medical equipment, and other hospital medical supplies, their respective distributors, different medical service provisions, medical groups, insurance companies, government agencies, employers, government regulators, and other users of the healthcare services. So all of us as individual people who just use the healthcare industry and their services are also participants in the supply chain cycle, which makes it very encompassing. So industry transformation. There is a growing need for supply chain management in healthcare in order to cut these costs and make healthcare more affordable. There's been a progression to self-distribution over the past couple years. Previously, a healthcare organization is focused on standalone hospitals, and this has shifted more to loosely affiliated systems that are able to manage themselves. These individual systems operate independently of the same department and other hospitals within the same system. Therefore, the negotiation of purchases is handled by a central health system. These self-distribution models are redefining supply chain management in healthcare. There's less focus on physicians performing supply chain activities, allowing them to focus more on patient care. Therefore, they spend no time ordering products or taking inventory. If the supply chain system is effective, it will be doing that job for them. There's also some debate over centralized versus decentralized system when it comes to the healthcare supply chain. There are benefits for both. A decentralized system focuses on decision making at an individual business unit level, which may be beneficial under demand uncertainty. It also allows you to quickly respond to customer needs. However, a centralized system is a coordinated policy with decisions made at a corporate level. So this allows you to maximize the overall supply chain profit rather than focusing on the individual piece, which allows you to be more efficient overall, yield higher profit shares, and have higher reimbursement rates for the provider. Overall, the best option is a hybrid structure that focuses on the best of both of these systems. Challenges and opportunities of healthcare supply chain management in the United States are fairly extensive because we have a culture that seemingly opposes drastic changes, but we also have a culture that is very angry with the direction of our healthcare for the most part. So some challenges are the many barriers in healthcare. There's a lack of executive support in wanting to implement a new system, which costs a lot of time and money initially. There may be misaligned or conflicting incentives. There's an extensive need for data collection that can get very specific and time intensive as well. You must have performance measurements. There's limited education on supply chain as it's a rather new and up and coming field. There's inconsistent relationships with the GPOs or group purchasing organizations and other partners that need to get sorted out in order to be effective. However, there are also these wonderful opportunities in an effective supply chain management in healthcare. It can severely cut costs. Our healthcare systems need to reduce inefficiency and waste on a nationwide scale. And instead of focusing all time, money, fighting the oppositions of restructuring the whole healthcare system, effective supply chain management can fix those problems of inefficiency and waste. This can be done through GPOs, those group purchasing organizations that negotiate the vendor contracts and reduce costs, also through alliances and partnerships, which reduce the transaction costs, and as I'll discuss further, also data standardization, which ensures accuracy and therefore patient safety. So supply chain performance in healthcare. There are many ways to measure performance in healthcare. Just a couple of them would be resource output flexibility measures, customer satisfaction, return on trading assets, and agility. And how you measure that just depends on your individual supervisor, executive, and how they feel that it should be measured. But overall, there's been a positive impact on organizational performance when they're involved in some type of supply chain management program or initiative. So the process-oriented approach is unique to the healthcare system in that normal supply chain systems focus on that product-oriented approach, and that's their end game, is getting the product from point A to point B. However, with healthcare being a service industry, it's difficult to ensure that the process is the same because you have to use the process-oriented approach rather than a product-oriented approach. And to do this, companies focus on being lean and agile. This allows you to be cost-effective yet also flexible. You're able to do more with less, taking that lean approach, and also have the agility to respond rapidly to those demanding changes. The important thing about healthcare supply chain management is that you are never done improving, and this can be done at all levels in the organization. Anyone can define new targets, identify new system roles, and define new and more efficient interfaces. And no one will ever be turned down for having a good idea. However, the most important across the board way to determine if your healthcare supply chain system is effective is if you're reducing your costs. This can be done through product standardization, such as minimizing inventory and matching demand with supply, decreasing the total number of purchase orders, and monitoring that inbound freight and the need to move items effectively and efficiently through the supply chain. So data standardization is a big part of healthcare supply chain, and it's one that I am partial to. This is an area that I'm really interested in studying post-graduation and continuing on with. And I believe that a lot can be done in data standardization because unifying this data makes it a ton easier, especially when it's been done in other industries and just hasn't been touched on in healthcare yet because it's such an extensive process. However, there is an overwhelming need for data standards. The hospital item master files are large and constantly changing. product data can quickly become inaccurate and obsolete, as you have to focus on all these individual manufacturers and distributors, and to make sure everything matches up is very difficult, especially when you have a manufacturer that makes the product with this code and a distributor that distributes the product, that same product that is manufactured but with a different code, and that's where the mixed match of information can cause real data concerns. And so I'll touch on those consequences of data errors. Data errors do not just affect the system overall, they can provide pricing errors from incorrect product data, resulting in the loss of a large amount of money. There can be wasted time from bad data as they work to resolve the issues with suppliers. There can be procedure delays due to not having necessary products on hand, and patient safety can be put at risk due to improper identification of a product. Even as simple as a product marked sterile versus unsterile, which might slip by, could cause a huge patient safety concern down the road. There are many barriers to data standardization, however, a large amount of that being cost, a shortage of capital, and the personnel needed to implement this. Many information systems are simply not compatible yet with that universal data standard system, and it can be disrupted to daily operations that companies have previously established and learned how they work and are comfortable with, and making that change can be difficult. However, it is very important that this step is taken because as much as 24% of supply chain administration time in healthcare is spent on data cleansing and corrections. I think the most important benefit of data standards that we can have in healthcare is patient safety. And a recent study conducted by Smith, Notman, and Pohl, 1/4 of their respondents indicated that their organization had observed an increase in patient safety simply due to data standardization. There have been many efforts to advance data standardization as it applies to healthcare. The FDA got the ball rolling in 2004 by promoting those data standards by requiring barcodes on pharmaceutical labels. They also considered requiring the similar kind of identification system on medical devices, however, that was not passed at the time. There has been a huge initiative of these global standards with the adoption of global local numbers, location numbers, the GLNs, and this initiative is for the electronic purchasing data. Challenges in that include identifying customers, classifying products, and identifying those products across the board. This can also be supported by those universal product numbers, or UPN, and this product information must be standardized among trading partners across the supply chain system, which is also a very, very intensive task, which is why it has not yet been completed in the healthcare industry, but it has been successful in other industries. So thank you so much for listening to me talk about supply chain management. As in regards to healthcare, here's my works cited, and I hope you learned a lot.